Yeah, David YouTube, welcome back to my channel. We are 3 for 3 in this series, and now I'm going to be recapping my pediatric class. And this was post-move, so this was at the North Brunswick, New Jersey campus. I will say that in my opinion, of all of the specialties, every single specialty, including complex, this was the most difficult specialty of all of them combined. And I feel very strongly about that, because there's so many different populations, and so it's not just like adults. There's even neonates, there's newborns, there's infants, there's toddlers, there's preschoolers, school age. Look at me forgetting already. There's school age, there's adolescents. I'm forgetting one, child, whatever. Anyway, so you got to know different things for different people. And so with this class, it's very much giving growth and development. Like how I said mental health was psychology and mother baby was kind of like anatomy, biology-ish. This is very much growth and development. The entirety of the class is centered on the foundation of growth and development. So if you don't know your growth and development, honey, you are SOL. So make sure you know your growth and development. That being said, Med Calc was fine. I don't think there was anything that stood out too crazy with that. Make sure you do your practice to start. But the chapters that we went through were social, cultural, religious, and family influences on child and health promotion, communication, physical, and developmental assessment of the child and family, pain assessment and management in children, which is tough because kids are not able to vocalize their pain usually, and especially if they're under a certain age, like, you know, if you're using different pain scales such as faces or cries, or even the Oucher scale. Pediatric nursing interventions and skills, child communicable and infectious diseases, the child with respiratory dysfunction, the child with cardiovascular dysfunction, the child with hematologic and immunologic dysfunction, the child with fluid and electrolyte imbalance, the child with renal dysfunction, the child with endocrine dysfunction, the child with cerebral dysfunction, the child with musculoskeletal and articular dysfunction, the child with neuromuscular or muscular dysfunction, and the child with cancer, death and dying. And so with this class, it was quite difficult for me. I just think, like I said, with all of the different populations, it was just hard to keep up and just to keep everything separate. So it's like once I felt like I understood something for one population, then it was like having to reapply it to a different population just kind of became cumbersome, and I just really didn't like that. Or having to always consider parents, like which sounds horrible, I know, but I know myself, and Drake said to know yourself and to know your worth, and I do. Yeah, so it was just pretty tough for me. So with the growth and development thing, I'm pretty far removed from the time that I actually took that class. I think I took it for the first time probably in 2012, so like 10 years ago. So with some of this stuff, it was kind of tough, so I had to just definitely like re-up on Erickson, Piaget, and internalize that stuff. Piaget, so you gotta know, what does it mean to be in this sensory motor stage? What does trust versus mistrust mean? What does it mean if you don't accomplish that state as a 1-year-old? What does that mean? You know, and what is the expected outcome? And if that's the case, then how would you approach that child? How would you treat that child? What kind of toys would you bring that child? How would you develop a relationship with that child so that they're able to trust you, so that you can provide care to that child? It's like so much like psychological play. I guess it's also like psychology, but then growth and development, a sect of psychology, isn't it? So it's like so much psychological thinking of how to do the appropriate thing so that you don't provide further psychological damage to the kid. And so I guess the big huge word is atraumatic, right? So you want to provide atraumatic care at all times to kids, and whatever we were discussing throughout the class and whatever you're doing is pretty much just to make sure that you are providing atraumatic care. And man, it was just stressful for me. I guess I'll give you some further examples about the types of stuff we touched on. So as far as communicable and infectious diseases. You know, of course, we talked about RSV. We talked about herpes and pertussis and impetigo. The things you should look for, you got to know like certain trigger words. Like if you hear honey colored vesicles like around the mouth, you got to know certain trigger words that'll get you to choose those answers. Then of course we harped on a lot of certain disorders. We harped on cystic fibrosis was a big one that we harped on quite a bit. Things that you would want to know for sure, like for example, you wouldn't put two kids who have cystic fibrosis in the same room ever. Like that's something that you would want to know. We talked about heart failure with young kids. We talked about anemia, hyper K, thyroid disorders. So we talked a lot about medications in this class as well. So there was a lot of meds that are used frequently with peds. Something that is also good to know is that your math skills need to be up in peds, because everything is weight-based. Every single thing is weight-based. And it's weight-based by kilograms. So make sure that you know how to convert from pounds to kilograms. You divide the pounds by 2.2 to get from pounds to kilograms. And everything is family centered. We talked about seizures, proper seizure precautions, seizure care, proper seizure precautions, you know, patting the bed. You don't want to put anything in their mouth, guarding their head, removing anything that's in the area, loosening up their clothing, guarding, protecting the head, putting them to the side to prevent any kind of aspiration. Life alert wristbands if they do have a history of epilepsy. Asthma is a respiratory illness that's very common in kids. Make sure that they know how to use their albuterol, also how they use your peak flow meter. You blow into it and you do it 3 times, and you take the highest of the 3, not the average. You take the highest of the 3, and that's the one you use, not the average. Listen to me, not the average. You take the highest of the 3. UTIs do happen in kids quite a bit, so that's something to note, that it also could be indicative of sexual abuse. Also note that you do want to always check for abuse with kids, whether it's sexual, physical. You want to check for bruising of different sizes and ages with kids. Fractures, that happens a lot with kids, so you got to be careful because kids are rough. They play rough, so you never know with them. Burns and how you want to rehydrate them, you got to check. Sorry, my camera died. Congenital musculoskeletal stuff, so like hip dysplasia, developmental hip dysplasias, muscular dystrophy, spina bifida, stuff like that, things that are prevented with folic acid. Oh, and then even the baby one, like microcephaly, myelomeningocele, diabetes, growth hormone deficiency, HIV, acute otitis media, organ neoplasms, leukemia. Childhood leukemia is very common. Hodgkin, non-Hodgkin's lymphoma, you know that Reed-Sternberg cells, that's like a very key thing. The key things with peds is weight, family-centered care, and the developmental age groups. And then also like some other things that pop up that you can remember is that in the adolescent age group, everything is about risk. So those kids, remember that time you were very much risk forward. So you want to think about car accidents and drugs, alcohol, sex. So you want to teach them about that stuff. But then again, when it comes to like consent, if they're married or emancipated, they don't need their parents for consent for anything. So that's important to know as well. We have quite a few questions on that kind of stuff, like just differentiating when they need consent. And yeah, so that was really peds for you. You just got to know the different age ranges and yeah, how to keep the patient safe. The main thing you can always remember to keep the patient safe is to remember your ABCs. So as long as you pick the answer that reflects airway, breathing, and circulation, you will probably not go wrong. So that will be my advice going forward for the CMS, which was actually a little bit difficult in my opinion. I did all 398 questions of the adaptive quizzing, you guessed it, and I also did practice A and practice B 3 times each, so that's 6 times in total. And for each exam, I also did the practice questions on ATI. I'll actually insert a clip showing you how I got to them. There's like practice test 1, practice test 2, and the practice final. And this is my first class where I actually had a final exam, which ghetto, but I guess that's an up north thing. That's all I got for this video. If you have any questions, make sure you comment them down below. Make sure you like, comment, and subscribe, and I will post more videos to follow. All right, guys, look at more.